Well, I think that the relevance with caffeine goes beyond the similarities between the two compounds. It goes to the point of understanding what is the purpose and what is the goal of public health measures, and the public health debate. So public health is about disease and death. It's not a moralistic discussion judging behaviors. So public health never discussed about caffeine, despite caffeine being one of the most dependent substances in terms of the number of people, the proportion of the population being dependent to some extent to caffeine. And we know that probably globally, the proportion of the population being dependent on caffeine is much, much larger, higher compared to the proportion of the population being dependent on nicotine. But there has never been any public health debate about caffeine because caffeine causes no harm. In terms of nicotine, we are now seeing, because of course there is overwhelming evidence now after so many years about the relative risk of harm reduction products, specifically, especially electronic cigarettes. So the discussion has shifted to the issue of dependence, which of course they call addiction. In my opinion, is dependence. And it's dependence because we know for decades that nicotine itself is associated with minimal, if any, disease. And snus, which is not even pure nicotine, it's a nicotine-containing tobacco product, has taught us so many lessons with the epidemiological evidence that we have available over many, many years about the relative risk of nicotine. This is, I think, the most valuable source of information, data, and evidence concerning the harms of nicotine itself. So we know that nicotine has minimal, if any, harms. So the discussion about dependence on nicotine is relevant from a public health perspective only if we discuss about products that cause harm like tobacco cigarettes. If you would need to smoke in order to obtain caffeine, then we would have a public health debate about caffeine, but because of the source of caffeine intake. In this case, we do have a public health debate about nicotine because of tobacco cigarettes being a source of nicotine intake. For the rest of the product that contain either naturally occurring nicotine, like heated tobacco products, which are tobacco products, or pharmaceutical grade nicotine extracted from tobacco, like electronic cigarettes, like we see in electronic cigarettes and in nicotine pouches, the debate about public health should not be about dependence. It should be about the relative and absolute risk of these products compared to smoking or the absolute risk by itself. But it's not, this risk is not coming from nicotine. And that's why I don't understand in Europe this frenzy, I must call it, concerning nicotine pouches. Nicotine pouches is definitely the least harmful of all nicotine products. They are basically the same as nicotine replacement therapies in terms of the content. They only contain nicotine, nothing else. And you don't heat, you don't combust nicotine or the contents of the nicotine pouch. And we are seeing a paradoxical situation of governments banning nicotine pouches. So banning basically a nicotine replacement therapy that is not, of course, being produced or sold by pharmaceutical companies. But there is no difference between a nicotine pouch and NRTs. So it doesn't make sense because at the same time, all these countries are allowing the legal sales of tobacco cigarettes, the most lethal nicotine-containing product. So I think that the public health debate should focus on harm. And let's discuss about the harm, absolute and relative, of all alternative to smoking nicotine-containing products. But the debate shouldn't be focused only on dependence, because this is a moralistic debate judging behaviors and judging people's choices. It's not about harm. and it makes no sense. It would maybe make sense if we had eliminated smoking, but we haven't. You know that in Europe, 23 to 25% of the adult population is smoking. Globally, we have 1.2 billion smokers, and that is happening after 60 years of knowledge about the harms caused by smoking. So there's still a lot of work that needs to be done. And I think that eventually, after 6 decades, we need to understand that we cannot eliminate smoking unless we provide a less harmful alternative nicotine-containing product to these people. And that's the purpose and role of harm reduction as a public health strategy. And that's the purpose and role of harm reduction products.